Welcome to Magnolia Medical Minutes, your local source for expert medical insight direct from the experts at Magnolia Regional Health Center in Corinth, Mississippi. I'm your host, Andy Stevens of SuperTalk Mississippi Media, and today's special guest is ER physician Dr. Luke Daniel. Thanks for joining us today.
Absolutely, it's a pleasure.
So the topic today is heart attacks. Tell me, what are the most common warning signs of a heart attack that everyone should know?
Yeah, so the classic symptom that we all think about is chest discomfort. People may describe it as pressure, squeezing, heaviness, tightness, or sometimes just an uncomfortable feeling in the center of the chest. The important thing to remember is that symptoms can look different from person to person, and you don't have to have severe chest pain to be having a heart attack.
So if someone's unsure whether they're having a heart attack or not, what would you tell them?
If you're concerned enough to think that you may be having a heart attack, the best thing to do would be get evaluated. So there's really no reliable way to diagnose yourself at home. You can have symptoms such as heartburn, muscle pain, anxiety, and heart problems. They can all feel very similar. We have tests in the emergency department that can help us sort that out. So if you're having any concerning symptoms, especially the chest pressure, shortness of breath, sweating, nausea, or pain spreading to your arm or jaw, please don't try to diagnose yourself at home.
Okay, so is it okay to wait and see though, to see if the pain goes away?
No, so if you think that your symptoms could be from a heart attack, waiting to see if they go away can actually be dangerous. Heart attack symptoms can come and go, and feeling better for a few minutes doesn't necessarily mean that everything is going to be okay. When a heart attack occurs, part of the heart may not be receiving enough blood and oxygen. The longer that continues, the greater the chance of permanent heart damage. That's why we often say that time is muscle, and getting help quick really matters.
When should someone call 911 instead of driving themselves to the ER?
So if you think that you may be having a heart attack, especially if you're having significant chest pain, shortness of breath, weakness, or feeling like you may pass out, call 911. One reason is that your condition can suddenly get worse while you're driving to the hospital, and if that happens, you don't want to be behind the wheel. Paramedics can begin evaluating and treating you immediately. They can obtain an ECG, monitor your heart rhythm, treat certain problems if they occur, and alert us at the emergency department that you're on your way.
Okay, so once you get to the ER, what are the tests and treatments that you might receive there?
So one of the first things that we'll do is an ECG, or an electrocardiogram. And what that does, it's a quick, painless test that takes a look at the electrical activity of your heart and can help us identify certain types of heart attacks. One important point is that a single normal test doesn't always rule out heart problems. So we look at the entire picture, including your blood work, your ECG, your chest x-ray, and your symptoms to try to come up with a plan and figure out what the next steps for you are.
Thanks for your time today.
All right, thank you.
Be sure to join us again next time on Magnolia Medical Minutes for your local expert medical insight direct from providers at MRHC in Corinth.